First video, take one. So first concept is float. If you can look, both cameras, we have gel on the transducer, which doesn't look like much in terms of the ultrasound. But I want to go over the amount of pressure that it takes to reduce the amount of float. So if I'm going for a dorsal wrist view, my left side of my screen is going to be proximal, and I'm going to generally just guess whereabouts the transducer first comes down. So, okay, we'll have to retool the views in terms of the hand placement because the distal view is blocked by my probe hand. So if I bring the distal radius and some levers lunate and the radial lunate joint space into view, you can see as I vary the amount of pressure that there is a black hypoechoic spot overlying the surface of the skin. That's what we refer to as float. So if, for example, I was to press down harder, one, I get some things into view a little bit better, but you can also see this space, which I believe is a vein. We don't have Doppler on this machine, so we couldn't be for certain, also gets obliterated. So in a good picture study, especially of small superficial views, it's good practice to have float, especially when trying to rule in or rule out synovitis, tenosynovitis, where we're looking for evidence of microvasculature. So once I've completely compressed all of the gel, you can see that it's very difficult to reestablish that nice level of float. So if you're in the middle of looking, you find what you're looking for, but you just need to take the picture, you can always go back, put probably that amount of gel back onto the transducer in a nice little line, and then slowly reestablish your picture with that little bit of float. There we go, right on top of the transducer. And if you're ever confused about whether you're floating or not, or what layers you're at, one, always count your layers, which we'll go over in another video, but two, just give a little bit of pressure and you kind of see just how slightly I'm moving the transducer. So that's generally float.